The undulating hills and terraced fields of Uganda's southwestern Kigezi sub-region are some of the most magnificent landscapes in East Africa. Often referred to as the Switzerland of Africa, the same terrain has made access to health services difficult in the sub-region. Leaders in Kigezi date this challenge back to the 1940s. At the time, some Bachiga elders developed a handmade wooden stretcher, locally called Engozi, to transfer patients from hard-to-reach areas to the nearest first level of medical assistance. John Byabagambi, a retired police officer and resident of Katoche, Kyanamira sub-county in Kabale district, is the treasurer of the Engozi Association. He says his daughter's life was once saved when neighbors carried her on a stretcher to the nearest health facility to give birth.
We just have a path, not a road. When it rains, like now it is a rainy season, it is impassable. So I cannot call that one a road.
Carrying patients on a stretcher cannot be done away with because it's the only means of transporting them in emergencies.
Somebody may be in the hill or digging somewhere, gets a problem, the vehicle cannot reach there, border cannot reach there, they will get that Engozi, get that person from where he has got a problem, bring him here or her near the road.
The carriers keep interchanging until they reach the main road. Here they hire vehicles or tricycles to transport the patient to a health facility. If a patient is a member of an Engozi group, he or she is transported free of charge. However, if the patient does not belong to any group, his or her caretakers have to pay between 20,000 and 30,000 shillings to be carried the long distance to the main road.
Some groups have cars stationed at the main road, which transport patients to health centers.
The stretchers, made from bamboo and reeds, are not covered on the top, so when it rains during the journey, the carriers take shelter in a nearby homestead to avoid exposing the patient to more health problems. Robert Turiachira, an Engozi maker from Bohara sub-county, sells a stretcher at 280,000 shillings or 300,000 shillings, depending on the customer's desperation. He has been making the stretchers since 1991, when he took up the craft from his late father.
The challenge is that my back now aches. After making an Engozi, the neighbors carry me to the hospital for treatment.
Turiachira's challenge is finding raw materials for making the Engozi. Due to the degradation of wetlands in the area, some materials like reeds are scarce.
I get the materials from Rwanda and Karama.
By traveling to Rwanda, the craftsman risks arrest. He calls on the government to support his work, which he says is important to the community, by funding him. Byabagambi declares that the making of the Engozi is still a monopoly of a few skilled elders who have not bothered to pass on the knowledge to the next generation.
Death is natural. You will die and die with that knowledge. If that man can also move and say, okay, you do this thing like this, do this thing like this, so that when he's not there, somebody can also use it, because we still have hills. These hills are not going anywhere.
Residents call on the government to provide ambulances on the roads leading to the villages so that people do not have to spend money on hiring ordinary vehicles to transport their patients to health centers. Sometimes, after walking long distances, the residents find the health center closed.
Why do nurses close the health center yet they are paid by the government?
Patients who die in the health facilities and have to be transported back to their villages up in the hills are also carried on the stretchers. Dr. Gilbert Mateka, Kabale District's health officer, explains that the district ambulances are always on standby to transport referred patients from the lower tier health facilities to the referral hospital.
We have those tricycle ambulances which are run by community groups, and the most common emergency is obstetric emergencies. These are mothers who are in labor and may need to be referred from where they were to another level of care.
Despite all those challenges, health workers within Kigezi region are trying their best to offer quality services. Actually, in the whole country, in the last financial year, we are number 2 in the whole country.
Dr. Mateka advises people to observe healthy lifestyles to avoid contracting diseases, since, according to him, 70% of the disease burden in Uganda is preventable.